And now we are going. All right, and we are now live. We're gonna give a couple of minutes for people to start joining us. In the meantime, how are you guys? Because I am extremely hot right now. It is, if you can see light around me, it's 7 times as hot as it's bright in this room. So it is extremely terrible. How, Ian, Dr. Burch, how are you guys?
I'm well.
Great.
How about you today?
Well, hot. Ian,
Hot. Sorry. Yeah. I'm hot and I'm sitting in my basement at home and I don't have any sunlight coming in. I'm still hot, but I think it's just hormones.
basements usually find the way of being just a right temperature. They're like an excellent dwelling spot. Yeah. How are you, Ian?
Well, I'm doing very well, Julio. It's great to see your face as always, and Dr. Jennifer Burch, always. We love you. But yeah, it's about, well, we just hit our record high of 118 here in Arizona. That was just set recently as of about 20 years ago. So yeah, it's pretty warm. And up here where I'm at in Sedona is about 8 degrees cooler. So we're still about 110, but I'm sure it has nothing on the humidity that you guys would have in your hot areas. So yeah, very nice.
Yeah, definitely the humidity is the killer. In El Salvador, when I grew up, there's this like food festival where chefs will cook on the pavement. So they'll put pans on the asphalt, and the asphalt's so hot that it'll actually cook food. It's insane.
Wow.
Yeah, I'm very happy in Canada where we have 9 months of winter. I'm very, very happy that I'm here. Thank you so much for joining us, everyone that's watching today. My name is Julio Ventura, and I do some marketing for Source, and I'm being joined today by Ian Pedersen, CBD researcher, founder and CEO of Source CBD. And we're being joined by Dr. Jennifer Burch, who is the owner of the Central Compounding Center in South Durham, and she currently serves as the chairman of the board for the Alliance of Pharmacy Compounding, or the APC. Today, we're here to satiate your thirst for CBD knowledge. We know that we are all constantly trying to do more research and trying to educate ourselves as much as we can in the world of CBD. So today, we're coming together to talk to Ian and Dr. Burch. So basically, how we're going to approach this is we're going to have a very light conversation. There's going to be a back and forth between Ian and Dr. Burch. They're going to be talking about all the industry secrets that they have accumulated over the years, over the decades that they have combined in experience. And then at the end, we're going to reserve a little bit of time for questions and comments. So if you are joining us for the first time, please make sure to talk to everyone else that has joined. There's a little button somewhere here in your Zoom window that says chat. Make sure that you share comments and that you say hi to everyone else that's joined. And make sure that above where you type your message, it says everyone, not just, it should say all panelists and attendees. If not, you might be just sending it to us, the panelists for the meeting. And additionally, if you have any questions, there should be a little button that says Q&A somewhere here. So make sure that you throw in all your questions, and at the end of the session, I'll jump back in and I'll make sure that we address every single question that we have. In the meantime, I will leave you guys with Ian and Dr. Burch. So I think you guys can now take it away.
Wonderful, wonderful. I just wanted to confirm, are you guys having a solid connection over there? I had a little buffering on my side. I just wanted to make sure that you guys were good and that I'm not coming in buffered at all.
I have a pretty good connection.
You sound good.
Everybody good? All right, perfect. I just want to make sure before we got started. Thank you so much. Julio, love you as always. Very, very thankful. So as you know, we are going to be kicking off one of the educations that we've been doing now. We're doing a few of these specifically directed at pharmacies, working with some pharmacists and professionals that we have known over the years. Now, Dr. Jennifer Burch has been somebody that's very close to my heart specifically. It's been a great pleasure in knowing her over the past few years and working with her in education and just basically working to uncover some of these new and exciting benefits of CBD. And I just want to thank her for being on board and being a forward-thinking individual as a compounder. We really like the compounding pharmacists because they're really such open-minded as to formulations and new things, and of course really geared towards natural processes, back to basics, things like that. I think that's why we really I think seem to get along so well with those philosophies. So I'm just going to start out a little bit today and talk basically my background. You guys are very familiar with me at this point, probably. You know, I've launched many state licensed facilities. I basically give lectures nationally. I've been a CBD researcher for many years now, launching state licensed facilities. And again, very thankful to be joined by physicians like Dr. Jennifer Burch. We'll be talking today about a few different studies that we've actually been working on. And the focus of my talk today, which we've been talking about many different issues, is really going to be focused on blood disorders. And specifically, we're going to be talking a little bit about type 2 diabetes. We were fortunate enough over the past years to work with many different people with blood disorders, ranging from thyroid conditions to diabetes, type 1, type 2, hypothyroidism, hyperthyroid, etc. And we've come to some very interesting conclusions, and that's essentially we're going to be sharing those with you today. So to start off, we are aware that CBD, as supplying cannabinoids to the endocannabinoid system, really does amazing things just from a natural beneficial support. You know, I've really come to the understanding that I'm not looking at it as a drug or a cure or a treatment. We're just looking at it as a natural beneficial support, just like a mineral or a vitamin, something that we could all take that really supports some of the disparities that we may be having at a central nervous level. And, you know, understanding that the endocannabinoid system is really the center of what we're going to talk about today and how cannabinoids can affect your central nervous system, we're going to kind of go into about really how those cannabinoids translate through the endocannabinoid system and then start to regulate and support some of these blood disorder issues. So Jennifer, I'm sure she's come across some of this work as well, and I believe she'll be talking later on today about some neuropathy and arthritis and pain issues.
Right. We'll talk about some of the complications maybe that go with some of the diabetes that you're going to talk about, and how that is important, because, you know, diabetes affects 30 million or so Americans know they have diabetes, which is about 10% of the population. So this information is really pertinent at this time.
Wonderful. Yeah, and I can see how, you know, neuropathy is something that for diabetes people struggle with in the evenings, you know, and at night, especially sleeping and pain management. So with that being said, we're just going to start off today, and I'm going to talk about 3 different subjects, essentially, in case studies that we're able to run with 3 different subjects ranging from different body weights, male and female, etc. And we'll go over those today. And again, their predisposition was diabetes, and that was type 2. And so with that being said, each one of these cases was previously using metformin. And metformin, as we all know, is essentially what it does is it supports it essentially supports the central nervous system's ability to regulate some of these sugars that we are getting through the foods that we are eating. Basically regulates those levels. And that's very similar to what we're going to be talking about today with a natural substance that really seems to support the endocannabinoid system and regulate some of those blood sugar levels that seem to be getting out of control. And, you know, and whether that's, again, predisposed, whether that's diet. In this case, we're going to talk about subject 1. Now, subject 1 is a female and is 87 pounds, age 66. Now, when we first came into contact with this subject, the blood sugar levels for her had risen to between 400 and 540 over a period of months. We essentially went in, and at that point in time, she was assigned she was actually going to be assigned an insulin and basically a diabetic drug for that. And what we found, and just by simply giving the CBD at a proper dose. Now, we were dosing at about 0.4 milligrams per pound, which was very high because we typically dose at about 0.1 to 0.2 milligrams per pound. But we could see that, you know, and based on our research, that we were going to need a little higher of a dose for that. And within 24 hours, we were able to get those levels down to 113. And that was something that was just astounding for us in one of the first cases that we were running side by side. Within 48 hours, we had the results down to 86. Which was actually getting close to being too low, because we know that 83, you know, we start to get down that low, can start to be an issue. So we ended up adjusting and basically just titrating up, you know, a little bit and adjusting that dose. And so we were able to hit a 6-month running average of 93. And this is with no use of metformin. This is one of the cases where they were actually going to be, obviously prescribed a diabetic drug. And in this case, it was about, a week or two, and there was a cost issue because at this point with their copays, they were looking at about $4,000 a month, which was going to be very expensive for a high copay. And so in that case, we were able to get them on the source, and that was actually a source 5,000 milligram. That's how we were able to do such a high dose at that 0.4 milligrams per pound, so we could really give a consistent dose. And that was one case that we had. Subject 2, and this was all over a 6-month period that we ran starting in January. Subject 2, male, 302 pounds. And that subject was age 63, and his blood sugar levels rose in the hospital to just under 600 during a 2 to 3 day stay at the hospital. Now, we were contacted by his wife, who I know, and my wife has worked together with her, and I actually know this gentleman from working at restaurants before. And we were contacted by him, and he did not have the ability to really even pay for the product, but it was something we wanted to get him on right away just because he's a close friend. And we were essentially able to get him on again a 0.4 milligrams because based on our research and what we're seeing, that we really need to attack something much harder than that average 0.1 to 0.2. And with that, he was doing 3 full droppers a day. And I believe that was actually putting him at around 145 milligrams per day. And within 24 hours, the levels were down to 112. Now, we did a 6-month running average with him, and we saw those levels drop to as low as 98. Now, this gentleman is somewhat obese for his age. So, I think it's a fair assessment that he's going to have problems with regulating those blood sugar levels. And he's been on metformin. It has been something that he has been on for a period of 5 or 6 years. But it just got to a point where they weren't able to prescribe him a certain level of metformin because once you get over that critical dose of about 2,000 milligrams, it's really something that can compromise from what we've seen. I think that safe range is about 1,000 milligrams when you start getting into it. And so really he was looking at just no alternative. And that was something where, somebody was already on something that was giving him some sort of support. And he was also using Coumadin as a blood thinner as well. That was something that he was using, I know personally, but and these are all subjects that they have no change in their regular diet. They've had no change in their regular day-to-day activity, exercise, etc. And these are the changes that we're seeing. And so we hit a 6-month running average of 103 with Bob. And that was probably one of our most phenomenal cases. Now, we did have a really interesting case. This is our 3rd subject. And this female was also admitted to the hospital. She was admitted to the hospital for another condition, meaning she was admitted to the hospital for a condition unrelated to diabetes. She had previously been on the source product and was unable to take the source product, the 1,000 milligram. Now, let's see, her body weight was 236 pounds, age 59. And she was unable to take the product as it was not authorized as in the toolkit. As you know, when you go into hospital, typically they're not able to authorize anything, of which I have an interesting story of going into Phoenix Children's Hospital and conveying legally why we cannot, why the reasoning why we cannot actually bring in a natural beneficial substance that we know is not going to alter anybody's diet and that is not illegal in any way. So we've actually been able to implement that in hospitals, but in this case, we were not there and able to be a patient advocate as we've had to in the past for people that have been in the hospital and have been past source patients, so or source advocates, excuse me, don't want to say that. So with that being said, blood sugar levels rose to over 400. They were able to, with a diabetic drug, with an insulin, to get her down to a regular, with metformin to get her down to end discharge at a 235. So I'm familiar, if am I correct, 240 is very close to having a heart attack, like you would be, that's a very close range to where you're looking at some serious cardiac issues.
Well, if you start seeing people's blood sugars be that high for a period of time, you start to see complications, but certain do vascular damage at that level, but not for a short term. Certainly you could think about it increasing some coagulability though, Ian, and increase some risks there. What we see a lot of times, people go into the hospital, and my mom did that, and she went to the hospital and didn't have any problems with her blood sugar, and she was sick and had an infection, and when they finally decided she could eat, all they brought her was a plate of sugar, And so they don't
Really?
feed you the most nutritious food in the hospital, so
Sure.
they tend to set you up for bad things. But anyway, continue with subject 3.
Yeah, no, that makes sense. Here's some Jello and some Gatorade.
And orange
Yeah.
juice, yeah.
Yeah, for sure. That makes sense. So blood sugar levels, they discharged her at that 235 to 240, of which she was really surprised that they had discharged her at that level. And within 24 hours of getting back on the source, her blood levels were back at 106 for her blood sugar levels. And that's just something that we've seen somewhat time and time again. We had many anecdotal results over the years without running a controlled study with 3 people that were actually, going to be prescribed or using metformin and then not changing their diet. It really gave us a bit of a better idea of the effects, as well as that higher dosing range to see that. I think that was really key. And so within 48 hours, she's back down to 83 to a 94. And her 6-month rolling average, 83 to a 94, looks like it was an 87. So she did pretty good there. And I think that was one of the most important studies we've done, in working with thyroid, hypothyroidism, et cetera, to actually see those blood markers change. And I'm interested to see what you think about that, as far as this specific study as opposed to how you think this may be overall affecting blood disorders, if you think it's really a serious viable option for regulating some of these issues.
That's a good question, Ian. I when you told me what our topic was, I went to PubMed, which is where you go look up all the medical literature. And if you put in cannabidiol and
wonderful study.
Cannabidiol and diabetes, there's 66 papers out there that talk about
over the past 10 years, probably there. Yeah.
Right. And so, there's some ongoing studies with that. And so, I, like you, kind of use that scientific process. Hey, I've got an N of 1. Let me try that in some additional people and see how that works over time. And then you correlate those findings to the literature that's out there. You do have to wonder kind of what the mechanism is of how CBD is working in there for diabetes. Does it help with insulin resistance, much like the metformin does? Does it lower hepatic production of glucose, much like metformin does? It seems to have some insulin effect or pancreatic effect based on some of those really high blood sugars coming down so quickly. And so you wonder if it helps with some insulin secretion, or if it helps to restore some function to the beta cells in the pancreas. Usually it wouldn't do that overnight with one dose or 2 doses, but it's some pretty exciting information out there about blood sugar.
Mm-hmm. Mm-hmm. Yes, that makes sense. Yes, well, that's good. That is good to hear, the correlation to that. I'm finding, just from everything that we have been doing with CBD, it seems like it just seems to work as a regulator. It is support to regulate so many of these issues. And when I look at the metformin as a regulator and regulating the ability to metabolize those sugars in the intestines, et cetera, pancreas, I think that there is a similarity there. Now, I'm not sure exactly the chemical composition of the synthesized insulin or metformin, because I'm not privy to the formulations on that and how that's developed, synthesized specifically, I would say. But I could hope at this point that the ability and the similarities in regulating these insulin levels seems to be doing something very similar without maybe some of the ongoing potential concerns that one may have in using something like a metformin for many, many years.
Right, because you talked about having to lower the dose of metformin because people can't get so high. Metformin is one of the drugs that you have to really watch kidney function on, because you can start to accumulate it, and it doesn't have, and so you have to watch the dose on that. And so you may not be able to get somebody to a dose that they're looking to get people to, which is usually about 2,000 milligrams is kind of their target. But if somebody has kidney problems, you're having to lower that dose, which may not be as effective just because you don't want to do any additional kidney damage. I do see that CBD has that effect on balance or homeostasis in the body with almost anything you give it with. That is just kind of the words that we continue to use. We've used that for years when I've worked with hormone patients in the pharmacy. We've used the word balance, and we talk about folks the same way with CBD is just to restore that balance in the body. And
yeah, I like that. Yeah, the
other way to
homeostasis
talk
that you
about
talk
that.
about.
Yeah.
All
And
right, I really.
I think we see some effect in some of the hormone patients with CBD as well. And it does have some impact on their hormonal balance or their regulation. And so, I think we're just at the tip of the iceberg with information on CBD. And, we did a talk at the pharmacy not long ago, and we looked at articles. I have a slide here somewhere, and we looked at CBD or just CBD, and on PubMed there were 3,220 articles, and that was up from about, it was up about 600 from the last time I'd done that talk, which had been about a year. So people are studying it. People are really interested. You and I could probably help people study it or design those studies or pick their products a little bit better, because we don't know what they're using and the quality of CBD that they're using. And so we like to tell people, if they don't have a response and they've used somebody else's CBD, that we'd really like for them to try our CBD, because we believe in it, and we believe that they should have a response if they dose it like we guide them to do so.
Yes, you've seen the efficacy, certainly, it sounds like, on that side. And the homeostasis, again, that's something that I really like. I like that term, definitely, because, yeah, the balance is so important. And I begin with blood disorders. We found people with that hypo, the lowered, essentially lower version of that, instead of a hyper, you know what I mean, where my wife, my wife, for instance, is always, suffering from hypothyroidism, very tired, you know what I mean? And so it seems that it can work to really not just lower some of those energy levels from a hyperthyroid standpoint, but actually raise some of those energy levels from a hypo, as you talked about balance, whether it's, on the high end or on the low end of an issue. It seems to kind of want to, in some ways, just balance and regulate those issues, at lower energy levels, higher energy levels.
And in those patients, you have to wonder about kind of that underlying inflammatory, even potentially some autoimmunity going on in those patients with thyroid. And so again, back to that regulating hormone levels and how the thyroid functions. And if we clear up some of that inflammation in the body by using CBD, then it tends to help regulate those hormones a little bit better.
Yeah, that word regulation just seems to come up over and over again with the supporting the endocannabinoid system, regulating the nervous system. So I think it's important that people like yourself and just educated professionals are now looking at, instead of looking at the central nervous system as the main focus, they're looking at something that predisposes that, or not predisposes that. What's the term? Is the governor? It essentially comes before that. So I think that would be the caboose on the train. The train is the nervous system, and then we have that caboose, which is the endocannabinoid system. So. Right.
We have a lot of doctors now sending folks over for a number of conditions, or just over to talk about CBD. And so we've tried that. We've tried CBD in a number of patients. And while we're talking about diabetes, the long-term complication, and the reason we want to get those people's blood sugar to the normal level, or to restore it to a normal level, is so that we don't get complications. And you try to tell people that when they're early diagnosis, and sometimes it doesn't resonate, doesn't stick until they're 10 years in, and all of a sudden they can't, they're starting to get tingling in their fingers and their feet, or their feet burn at night, or they're 20 years in and they can't feel their feet. So it makes it really hard to walk because they can't feel the floor. And those are the people that, that's exciting to have the data that you have, so that we can prevent those people down the road from having those complications. We don't see a lot of those people in that preventative stage at the moment, but we have seen a number of people come in with neuropathy. And I got one guy who came in who's had diabetes probably long as you've been alive. So probably a good 30, 40 years. And, can't feel his feet. That makes it really hard to pick your feet up. You don't even know spatially aware. It's like putting socks on a dog, right? And they're walking like they're crazy. That's how he is with his feet. And I had a discussion with his doctor about another patient or two. And so his doctor sent him over to try CBD. And so we got him started on CBD. And I don't know, he came back in a week or two, very, very soon, or called us one. I think he came back and said, "This is amazing. For the first time in 20 years, I can feel the carpet under my feet.
Wow.
He walks, but he
The
couldn't
nerve
tell
station.
what surface he was on. And so now
Wow.
he's way better. But that was just a pretty amazing response just in a couple of weeks to wake those nerves up, because there aren't a whole lot of medications. Actually, I would tell you as a pharmacist, there are no medications in the regular pharmacy that will do that. The doctors, that's a complication. The doctors give them drugs to help with the pain, but there is no reversing neuropathy in traditional medicine. That's just not what they do. They may put them on a B vitamin. They may get a little bit of response there, but there's no reversing neuropathy drugs out there. And so CBD has been pretty amazing with that.
Wow.
This same guy had a family member who was in a car accident that had a crush injury, like the kid almost died. He's a young man, probably in his early 20s now, almost died. Like his whole lower half got crushed, and was still walking, maybe even was still in a wheelchair, but still walking with crutches and that type of thing. And his mom was a customer at the pharmacy, and so we knew a couple people in the family. And this guy started CBD and had like a be healed moment. It was like amazing. All of a sudden he was up doing stuff, working. He wouldn't get out of bed, and all of a sudden he was up, working 6 or 8 hours a day, and actually got a job and went back to work after starting CBD, which is
That's amazing.
Life changing to somebody.
Yeah, it has been, and we've seen talking about. Now, we've seen those exact instances, people that were, in at that turnaround point where they may not make that turnaround, coming out of a trauma, an accident, a serious surgery, and or late stage old guy construction worker can't make up the jet, literally his knees hurt so bad, just from working hard their whole life. And we've seen those turnarounds, and, he's, one of the cases, my dad's running up the stairs like a kid again. He's actually running up the 3 or 4 stairs, and, getting up them quick instead of like, so again, I think we're talking about, and would you say that communication, that cell communication, that's what I think intuitively we keep coming back to, is the ability, because if they're taking something where there's no ability for them to work to stimulate those nerves in that area, the nerve endings are not responding apparently, right? But through simply supplying the endocannabinoid system with something that can support the endocannabinoid system, and then the central nervous system converts to proteins, all these different cell health and anandamide, then all of a sudden we see this boost in communication. It seems like the communication is really, for me, out of all of my studies, the most important factor of the cell health and of the cell population. It seems like it stands in the middle, right? Because if you don't have healthy cell communication, then it's going to be impossible for your body to probably function on an electro level. You know what I mean? As we function on electrolysis and communication.
Right.
So I think that's been probably the most interesting thing, is looking at how just boosting cell communication for neurological disorders, boosting cell communication for neuropathy that's actually calming in some. So it would boost the cell communication to where the nerves are responding, in this case, what you're talking about. Right. But then in some cases, it's actually blocking these unwanted synapses, this overage of synapses, right? Which is also cell communication, pain responses, pain receptors that are constantly coming, as we spoke previously, coming from that localized area of pain that's being sent to your brain through your central nervous system and being regulated by your endocannabinoid system. Yeah, it sounds like that one thing, being able to just have our cells communicate, seems to support in so many different issues. The proliferation for tumors, skin tags, eczema, psoriasis. We got somebody right now with a really bad eczema. His legs, he won't ever take. He comes over to swim. He's one of the teachers for my son's school, and he wears those like sports black things over the legs,
Leggings, yeah.
yeah. And I was wondering kind of why. Maybe he just didn't want to get sunburn or something. And then he divulged me some, eczema is just so bad. So got him on the Source app. He said he's been on products for 10 years working on his eczema. He said within one day, he had not seen the effects of what a salve, just a simple topical CBD salve, not even our product, because that's not what we're here to talk about today, but to be working with something like that, and to be working with steroids, because typically it would be assigned a steroid, I believe, and a topical to work just to alleviate the pain from the oxygen getting to the open skin and to the wounds. So
right, and he's probably been on a really expensive drug regimen too, if he's tried that many drugs, because they get into some of the drugs that are immune modulators, even down to things like tacrolimus and whatnot, and sometimes they just don't work for people because they're not fixing the problem.
They're not supporting the actual root issue, right, which is a cell disorder or a support issue with some sort of protein or some sort of mineral, whatever you're not getting in your diet that's not supporting your health, or whatever you're getting in your diet that's breaking down your health, possibly from pesticides, chemicals, tests. Yeah, that is really interesting. Wow. Yeah. So that also leads me to something else. We're just kind of keeping it open here. Is burn victims. In burns, we actually had somebody where we did a controlled test on a part of a burn, a very bad 3rd-degree burn. And then where they actually did not do the controlled test on the other part because it covered the entire hip of this person. And it was night and day with the, we actually posted this on our website, but it was night and day. You know, you're talking 3 weeks to 4 weeks ahead of the other, the pigment coming back, reducing in the pain, you know, that neuropathy, that cell communication, the cells are angry, you know. So I think that it'll be important for us to start looking at, and I think it would be very interesting to be able to actually start to work with burn victims. That's something I'm kind of compelled to do because I've seen it not only seals, but it starts to support those cells and those cells that are in such dire need of support for whatever reason. You know, instead of just giving them steroids and say jumpstart, you know, jumpstart that immunity or whatever. Again, I'm not a physician, so I can't necessarily speak to that, but I'm assuming that's really, you know, a stimulus. It's either a stimulant or a depressant. There's typically 2 different versions of the toolkit. And so the support, the natural beneficial supports, I think are what's most important.
Yeah. I anecdotally have used it on a burn on my hand because that was what I had sitting on the counter. I was like, ow, burn my hand, and that's really red and it's really stinging. Let me, what do I have? Let's put some CBD on there and see what happens. And,
sure,
you know, I don't think I applied it more than once, and maybe applied it again the next day, but, you know, use it topically for some of those burns and boo-boos and that kind of thing and whatever's going on because, you know, it won't hurt it. And so if it helps it, then I've, you know, sped up that process of healing for myself. And so it's good to hear that. And it'll be interesting to follow that down the road because burn victims or burns like that, they don't do a lot for them, and there's not a whole lot they can do. You know, if they get infected, they put some antibiotics on somebody. You know, they try to keep them moist sometimes, or they won't keep them moist. And, you know, it depends on the doctor. And, you know, some of these people end up in some of these wound care clinics, and, you know, the bigger the burn, the worse the outcome there. But to be able to fix a burn like that, you know, especially somewhere right there on somebody's hip where they're trying to wear pants or that kind of thing, that's a hard spot to continue on with, you know, activities of daily living while that's healing. So
yeah, definitely the management of that. And I would love to really, there's a personal story from my youth that would really I think would be important for me to be able to make a dent there with that. You know, some other interesting things that we've come across is I was working with, and this is actually one of our employees. He has been on an antidepressant, and this is just something that came up this last week. He brought to me. He said that his urinalysis test is testing for 0 levels of the Zoloft that he has been taking daily. And so what has been interesting is he has been also taking the CBD daily. Now, what is a quagmire for his physician, his doctor, who is now pulling him off Zoloft because she doesn't think he's taking it. Now, this brings up an interesting point. I've noticed that cannabis and CBD and the plant works as somewhat of a filter. I've cultivated it for many years, and one of the scientific properties of cannabis and hemp in particular in the plant is that when you plant it, it filters out all of the impurities in a soil. And that could be chemicals, metals, pesticides, anything, which is really interesting. And the plant works as a filter. Now, if you were to harvest that plant, if you grew it in an area that had a bunch of poor pesticides and metals and all that built up, you know, in a landfill or something, the plant, you wouldn't be able to actually utilize it because it's going to then take those properties out and use it as a filter. But we've seen that it can actually, what it also does is it then rejuvenates over a period of 2 years. It actually then puts back in nutrients into the soil. So it strips out the soil of all of these types of impurities and then actually puts back in purities. Now, I've always kind of shot from the hip with this, you know, with my research intuitively, because, you know, I've had such an experience with the plant over the years and such a symbiotic relationship that I really try to look how nature is exhibited across across, our planet Earth. Like, for instance, I wasn't looking at my pH balance. I didn't even know about pH balance until I started looking into plants, until growing plants in 2001. And so with that being said, what we're realizing is that the plant in some ways may be a natural filter for our bodies. And so the evidence that I'm seeing is that it may be possible is that taking something that the body would deem as an unnatural substance, that I believe that possibly, I'm hypothesizing at this moment, that the CBD that he is taking is in somehow working as a filtration system, similar to how, let's say, you were taking in heavy metals that are negative. If you take in, your body will take in aluminum, your body will take in lead, your body is thirsty for metals, right? It'll take in almost any heavy metal, and unknowingly and indiscriminately, we'll say. However, I believe it is well known, and I'm not sure if you're familiar with, but if you take magnesium, that it will actually help to dispel those other heavy metals. Your body will then choose the right metal for itself, because the body intuitively somehow magically might know what's right for it. And this is just, again, I'm hypothesizing here based on the information that I've seen, So could it be possible that the metabolization, and if we've heard about the cannabis supporting an inability for metabolization of other drugs, if we've heard about that, or different production, I'm just wondering if that's something that you see as it could be possibly relevant.
That's a good question there, Ian, because we don't usually see a drug interaction with this CBD and that class of antidepressants. So that's interesting. You certainly wonder if it's the effect the plant has. You start to get into some genetic testing now, and you wonder if that's the best antidepressant for the patient, and is he able to process that antidepressant at all? Because some people, based on their genes and what gene SNPs they have, that may or may not be the best drug for him. And so you start to learn more about personalized medicine when you're looking at some of those pharmaceuticals, particularly for that category of drugs. And we're seeing more and more doctors actually do some genetic testing when they're looking at patients on antidepressants, because either they're just not working for that patient in that instance. And so that's a good question. That'd be really interesting if enhancing the endocannabinoid system with some CBD had that effect on the body to kind of increase its ability to know that some of those drugs were maybe not the best for us, and filter them out, or kind of guide the system into neurotransmitter balance or that type of thing. So it's an interesting hypothesis.
Yeah, maybe just choose what's right. Yeah, it's interesting. Yeah, I'm thinking that maybe the system is naturally choosing what's right, as it would in some of these other conditions. So, and he was actually on Zoloft up until he started CBD. So he had been on it for a year plus, and he's only recently started the CBD regimen, probably 6 months ago. So that was an issue where his doctor saw those levels dropping, and then of course not even showing up in his blood. So that could be interesting, because as you talked about the interactions, we don't see any contradictions or any interactions when we're giving a child that has neurological disorders the CBD, and they're on a litany of different neurological drugs for neurological disorders, and or in this case, if somebody that's on an antidepressant, we certainly am not going to recommend them to stop their antidepressant. We would like them to, speak to their physician if they choose to introduce this into their diet as a natural beneficial substance that can help to support their body in other natural ways that can give them a better outlook and give them a better effect. Then that's really what we're pushing for. But yeah, just to see, because I guess there was a study about the ability of vitamin K production in the liver enzymes. I don't know if there was something that had just come up at one point in time over the past few years, and they were talking about the ability for certain drugs to potentially metabolize, and saying that CBD could potentially inhibit the ability for these drugs to metabolize. So I guess if we were to put it on the flip side, what if the patient 0 went to the doctor, and the doctor said, "Oh, the Zoloft is not showing up in your system at all, hardly. We need to now double your dose." There could be now an issue, correct? Where there was a misdiagnosis based on the fact that they think that these levels should be showing up at X based on body weight and based on dosing. And for some reason, it's not becoming as bioavailable. So now they're dosing the patient double. Now that could be so I think these are some interesting questions to ask. And I always wondered if for some reason, these other drugs that were being taken, whether it was for neurological, neuropathic, any of these other drugs, or serotonin reuptake inhibitors, etc., if they're just bypassing it. If it's the CBD, if the body is saying, hey, I'd much rather try this. This seems right for me. Vibrationally, frequency, naturally. I mean, all these different, I feel like there's probably a lot going on there. And then to say, oh, well, I don't know if this is right for me, and I'm going to just pee this out. I'm going to let this out to my lower extremity. And that, I think those are my hopes, because we haven't seen people have those contradictions or interactions at all. There have not been any recorded interaction that we've had in the last 6 years, and 8 in the studies.
Yeah, we've, in the literature, they talk about potential drug interactions, and, you have to tease out whether they're talking about CBD or whether they're talking about THC when you're talking about drug interactions in there. And, that's always hard to figure out, because everybody's got it all wound up together of what they think that is. And we talk to people about medications when they come into the pharmacy and ask them about what drugs are on, and just give them some, information about that. At the doses that we use, which are in your guidelines there, of 0.1 to 0.4 milligrams per pound per day, we haven't seen any kind of drug interactions with anybody, even drugs that were kind of questionable of, there may be a potential drug interaction there. And so if you look at the dosing that you use and recommend versus what the Epidiolex dosing is for seizures, and the drug interactions that are there, their doses are significantly higher for CBD in a day. And, they talk about maybe it interacts with some of the seizure drugs, but at those high doses, yeah, maybe it does, but we don't see those high doses, and having to use those high doses very frequently in people. So
it's an interesting point.
I feel pretty safe recommending it to most people taking most drugs. And you said, we always worry about Coumadin or warfarin, the anticoagulant. And you said that one of these patients was on Coumadin, and so you obviously didn't see the patient didn't have any adverse events from taking Coumadin and CBD. So.
And it's really good, and I guess maybe that's the body choosing the right thing, hopefully. And in that case, or the fact that it's a natural beneficial substance. The one thing that I think has been the thing that makes me feel the best about our work and research in this study, in these studies over the years, is that we know that the worst thing that it can do is just not help. That's possibly the worst thing that CBD can do to you, is just not be effective. And hopefully you'll find the right range. And, but I mean, with that being said, we don't have the culpability, I think, and the responsibility that some of these other manufacturers have. And so I think that's probably why when you see Epidiolex putting a list of contradictions and drug interactions, if you look at their list of drug interactions, it's a list of every drug that you could possibly take. It's a list of 75 different popular drugs that are being taken for many different conditions, from neurological and neuropathic blood disorders. And I think that, from a standpoint is that they are a pharmaceutical product, that they have much more of a liability.
Oh, sure.
And that they have to really cover that. And they just have to say, we're not sure, so we might as well put it down that it could, and can confuse people when they say, well, I looked at CBD and says I can't take it with any of these drugs. Well, what type of CBD are you taking? Who manufactured it? What's the delivery method? What's the potency?
Right.
Yeah.
And you were talking about using it in this young man for depression or his effect with depression. So we had a patient that came in the pharmacy who was on a number of things, and Jason, my employee who works with folks the most at the pharmacy, said here that we had a patient that was on Prozac or fluoxetine, Wellbutrin, and Valium or diazepam, who came into the pharmacy looking for some help. And they said since they started their CBD, they didn't need to take all of that. They were able to reduce all of those doses, if not discontinue them. And CBD had changed their life, and I'm feeling much better, which is a pretty amazing testimonial for somebody who has tried. That's not the first, those 3 drugs are not the first drugs they've tried to feel better, that's the regimen they've landed on after years of working with a doctor and still don't feel good. And I think this was the lady that was retired. And she said, I don't know why I retired. This is not pleasurable. And I'm on all these drugs and, I just don't feel good. And CBD was like just like woke her life up. And she was amazed at and so was her doctor, but she was amazed at the benefit that she got from CBD in just a short period of time. And so you think about, if you feel that good in a short period of time, what's going to happen when you take it for a longer period of time? What other beneficial changes are you going to get in the body? What other protections are you going to get from taking something like CBD that you may or may not even know about down the road, right? If it has a benefit on blood sugar balancing, then wow, do we even know that I was able to stave off diabetes as somebody who has diabetes in your family? So you don't even know about some of these positive benefits that we could be getting out of using this product in our patients.
Yeah, no, I think what you're saying is very valid. I honestly, I think we're at the tip of the iceberg with it, and that iceberg goes all the way down. And understanding the benefits for isolated cannabinoids and understanding the benefits for different terpenes, and really, I think we're really just starting to be able to get some sort of an understanding from the genome level. I think as we move further into those studies on the genome, we'll be able to probably have a better forecast. But I like to say that, yeah, it's probably doing many, if you're using it for one particular thing, it's probably doing many different things to support your body as a CBD support, just because of all the beneficial terpenes. And we talk about plant composition. Having, one particular plant that you may take as an essential oil has one terpene in it. This plant has multiple different terpenes that are exhibited across nature in every different plant, from limonene to terpenoline, beta-carotene. When we start to look at those, I see those as really the benefits for the protein conversion and the support in converting these really beneficial proteins, not just the cannabinoids, which I think really speak to the communication levels for the endocannabinoid system. Research is recently coming out for glaucoma patients that it wasn't really I think we may have talked about this before, that it wasn't really the THC or even the CBD, the cannabinoids. It's really a terpene, a limonene in it, and the beta-carotene that's really supporting the cell growth and or the correct cell growth, because we have glaucoma, it's just a cell disorder, right? We've got that film that's growing over the eyes, and that's a cell disorder. And, so I think anecdotally, the government, in looking at that many years ago with THC, was looking at that as a benefit and said, hey, we've got people on THC, they're using cannabis, it's helping for glaucoma. But they're not able to really isolate the cannabinoids at that point. They're not able to isolate and understand that it has beneficial different terpenes. And so that phyto-rich compound, it seems like that's really that's what's creating that homeostasis. And so as we move forward, I'm excited to further isolate these cannabinoids. Now we're working on, not just CB receptor 1 and CB receptor 2. We found that CB receptor 3 is now valid in the system. And so we're really learning a little bit more about how that works and how our bodies can just continue to benefit from these cannabinoids. So, really amazing studies that we've come across. And obviously, I know you working with this for the last few years have just helped so many people. And I don't think that there is I want to ask you, as running as a compounder and being such an educator in the field, do you think that there is one thing on the shelf that you have that is as versatile, that can be used for so many different things to help people as CBD? Do you think you've come across anything ever?
Not over the counter. There's nothing close to it over the counter. Prescription wise, we use a lot of a drug called low dose naltrexone.
Oh, naltrexone, yes. Mm-hmm.
And it in a really low dose, it helps to modulate the immune system and helps with inflammation. So I think CBD and low dose naltrexone actually have a very synergistic effect. I think they work well together, and we've seen that in a number of patients, from anything from pain to fibroids and that kind of thing. If the patient wasn't getting full relief on one, if you add the other, it takes it up a notch. And so that's been amazing, but there's nothing close to over the counter. Magnesium is probably the biggest thing I can do over the counter for somebody that's even close to fixing a number of conditions is giving them magnesium. But CBD has been a game changer for us at the pharmacy, and in the way we're able to help people without having to have a doctor write a prescription for something. And so that's been really nice. We are a compounding pharmacy, and as most compounding pharmacies, we work closely and have good relationships with patients. And so they trust us, and they're looking for our guidance on what to take or what to take for this ailment. And when we started working with CBD, it changed the game. And so we are the CBD experts in town. And so we have a number of doctors that come in that take it themselves, and we have a number of doctors that refer people over for it, for anything from migraines to just plain pain and neuropathy, like you said. We've had some pretty good experiences with anxiety and mood as well. And so it's been a game changer for us to put that as one of our tools in our toolbox.
Awesome. I'm so thankful to hear that. Yeah, for us, it's been an amazing journey. And I'm really thankful that over the years, we had an opportunity to meet you and other like-minded physicians and professionals that really just have that forward-thinking approach, that sustainable approach to medicine, and really natural beneficial supports instead of being reactive, being proactive, and giving us the opportunity and your patients the opportunity. I think I really have to commend you for that.
Thank you, Ian.
All right, and I think that that's a pretty good point to jump into some of the questions that are coming in.
Yes.
So just a quick reminder for anyone that's watching us that there should be a button somewhere around here that says Q&A, so make sure that you use that to send us your questions. The first question here is, Dr. Burch, has there been any one specific method of administration that has proven, in your experience, to be more effective than the others?
We like the sublingual drops, and so we start with drops. We think it's easy to titrate the dose, and so we teach people how to dose CBD by the drop. We calculate their weight. We calculate a dose based on their weight. We give everybody a chart to take home, so it shows them exactly how to dose their CBD. There's no ifs, ands, or buts about how to do it, and so we teach them how to do drops and split their dose up twice a day. And so drops is our go-to. If we have somebody that's averse to the taste, and occasionally you get somebody that doesn't like the taste, we may switch to a capsule, but 98% of the people that we have are okay with the drops, and we do quite well with those.
Okay, and speaking of that, just so everyone knows, I on the Source website, we have a dosing calculator. So I'm gonna get the link as we move in the next couple of questions. I'm gonna get the link and put it in the little chat box so that anyone that's looking to have that little dosing calculator. And is there any particular method of doing sublingual drops, or is it like as simple as literally just putting them under my tongue and then just moving on with my day?
That's what we tell them, is as simple as putting it under your tongue. We tell them to count the drops. So we may have them, we tell them to do that in the mirror, right? Because it's hard to count the drops. You don't want them all over your face, right? Unless you're my dog and you just lick them out of my hand, and they do pretty good with those. So we tell them to count the drops, put them under their tongue. We tell them to hold them there for about a minute, trying to get them to hold it there for 30 seconds, really, right? So you always tell them a little bit longer than you really need them to do that. And then just kind of, swish it around in their mouth and finish swallowing whatever's left of that. And so, 30 seconds to 60 seconds under your tongue is a good amount.
Would you recommend drinking it with anything, or would you just recommend just leaving it there and then moving on with your day, and then eventually, having
I recommend it. Yeah, I recommend leaving it there. And then if they want to drink something after they've swallowed it, I don't have a problem with that type of thing. If we were treating somebody's gums or something in their mouth, a sore in their mouth, then I'd want them to keep it there a little bit more and not wash down whatever was left in their mouth. But 30 seconds to a minute, and after that, I usually don't give them any guidance on that. Okay. What do you tell them, Ian?
Yeah, I'd like to say, as long as you can get it into your system, definitely, to hold it sublingually if they can. I know some people have an aversion to that, as it's oil. So really, we find that if they can just get it into their system, and even if they did have to put that into a drink, a juice, or something to carry that, then it basically, with the bioavailability of the coconut oil, fortunately, that's going to do a lot of the work and really give the ability over time, 45 minutes, and then that 8-hour period to really become bioavailable and metabolize. And then we see that metabolization rate about 8 hours. With the dose, that standard dose that you find for yourself, your body weight.
I do have some pet owners that put it in water, so that's kind of that same process, I guess. So for their dogs and cats.
Yeah, however you can get it inside you, as long as you can get it inside, it'll do wonderful things. Yeah.
That's so ambiguous that it almost feels dangerous. So, so the next question here is: you talked about some of the neurological damage that comes with things like diabetes and whatnot. So when people take CBD to treat some of these conditions, is it does CBD take a reconstructive role, or how does it compare to painkillers and what is it, neural blockers?
So you always wonder what it's doing, Julio. You never know what it's doing, right? Is it just helping the pain, or is it helping to restore that tissue damage that we have from that neuropathy? And so Ian talks about self-communication a lot. You start to wonder if you're able to, put some of those nutrients back in there through CBD oil, which we call it, cannabidiol oil, but it's got all that other stuff in there Ian was talking about that's nourishing to the nerves. And, there are ways to restore some of those, the myelin sheath and the outside structure around the nerves that once it starts to deteriorate can cause some of those problems. And so you wonder about it restoring function. I don't know that we've proven that, so we can't claim that, but certainly that is a hypothesis that it restores function in that cellular communication, which gets all back to that balance and homeostasis type of words that we keep using with CBD.
Ian, do you find it that there's constantly people doing research on this, or is CBD kind of like homeopathy, where, well, homeopathy and CBD are very different for many reasons, but I only pick homeopathy because I know for sure that that's kind of like something where the mainstream scientific community has kind of like been like, okay, we're not going to keep doing studies about this. We're not going to keep looking into this. Is CBD something that is constantly being researched right now?
Yes, and I see more and more studies happening, and we talked a little bit about the literature and how it's exploding with articles on CBD everywhere from pain to cancer to brain tumors and all of those type of things. And so, yeah, I think we're just on the tip of the iceberg. What's funny though, is you get people that are doing studies. So like I've had multiple people tell me that here in Durham, I'm in Durham, North Carolina, where Duke Medical Center is, Duke's doing a study on CBD and brain tumors. I'm like, they are? Nobody's ever like asked me about CBD and brain tumors. And they don't tell their patients with brain tumors about CBD readily, at least. Because I had a husband had a brain tumor and the wife was a hormone patient, and she said, well, they haven't told us about this. And I said, well, maybe ask him. And she took the bottle over there and said, I'm going to give him this. What do you think? And they're like, oh yeah, that's a really good idea. But they wouldn't tell the patient that. And so there's a lot of information going on out there. I think there's a lot of confusion in the medical community. There's a lot of confusion in the veterinary community of whether they should recommend CBD. And some of that, I'm sure, is the medical societies and the veterinary medicine societies that have said, don't recommend CBD. And so, sometimes people will come in and they'll say, my doctor said I should look at this, but they can't recommend it. Can you tell me more about it? And so I think they're a little bit leery. They haven't had the education. They haven't had the luxury of hearing Ian and a number of other people around the country talk about CBD. And so I think, what I always say, that you're on the cutting edge. And so it'll take everybody else 7 or 8 years to catch up with what you're doing. Well, we're a couple years in now. We'll see.
Yeah, that's a consequence of being in the forefront. Yeah.
It is.
You're making the way.
Well, our hopes are that the universities will take note of this. And I think what Jennifer was just talking about, I think one of the issues there with Duke is probably that they receive federal funding. And the fact that they receive federal funding, it really has, it has created an inability for any university nationwide to really do a credible study. We had a Dr. Sue Sisley here who was ousted from from Arizona State University, who then wanted to do a study, and she was basically ousted for wanting to set up the program. And it could, obviously the CBD could conflict with the benefits of CBD could conflict with the marketability of other products, possibly. There'd be, in the great distribution medical system that we all know. So with that,
chemo is so good. It's so effective.
So good for you. Yeah.
Yeah.
Said no one ever.
Yeah, I know. They don't talk. Yeah. Unfortunately, they don't talk much about diet and support like that. But fortunately, we have had an opportunity to work with a few oncologists, and we were working actually with an oncologist, Jennifer. I'll keep it brief here. We're working with an oncologist out in Nevada with a gentleman in prostate cancer. The gentleman, his PSA levels were at 12.2. We were able to get those PSA levels down to 2 within a period of 90 days. Now, we weren't seeing any effects on the 2,000 milligram, which wasn't a high enough dose for him. Once we titrated him up, I actually received a personal call from the physician with his curiosity saying, look, we're seeing something really, really strange here. We've only changed this and we're interested in finding out more. And so, I think that there are some really interesting things that we can do in supporting, working with oncologists to give them some other tools in their toolkit, which would be, I think, really great, because I think talking about self-support instead of talking about attacking cells to kill cells so that we can alleviate free radicals, et cetera, the very invasive method. We're definitely hoping to not have to go down that road. So yeah, definitely. Hopefully the education will open up.
And Ian, do you find it? I mean, probably Dr. Burch, you also have some experience to talk about this, but I have worked in the natural health industry for pets for the last 5 years, and I do find that there's a lot of things that as a more scientifically driven person, there's a lot of things that I go, oh, okay, all right, sure, whatever. And then I have found it that CBD kind of like gets linked to these very holistic, non-peer reviewed solutions. Do you find it that there's ever some sort of bias in general in the mainstream against CBD for being a natural remedy?
No, I think we've seen some pushback from some of the other possibly purveyors of relief, we should say, in those fields. We could look at a product like Bute, which is used heavily, Buterol, which is used heavily as an anti-inflammatory in the equine community. Are you familiar with that, Jennifer? You ever heard of Buterol? Yeah. So with that being said, it's something that I wouldn't consider to be a sustainable approach, something that you can, continually incorporate into the diet. It'd be about as sustainable as I'm taking an ibuprofen every day, or a consistent amount of ibuprofen for your stomach lining. So, with that being said, we have seen a little bit of pushback from some of the traditional community, but again, as Dr. Jennifer Burch said, and I have to be thankful for some of the initial studies that I was able to actually present in correlation to my own studies, were actually founded on PubMed, and this was years before, essentially, 3 years ago, those studies that I was presenting, Jennifer talked about, some thousands of studies now, and there were previously only hundreds. There were probably a good 50 to 75 studies that were for tumors, that were for, that we're really talking about the benefits of cannabidiol for inflammatory issues, for tumors, for neurological. And it had been just minor studies that had been done by different physicians that they had, taken the time to write a paper on and submit it to PubMed. And that was really, I think it helped me to solidify a lot of the anecdotal and clinical data that I was gathering, to then say that this is really there is a foundation for why I'm seeing this. And so as Jennifer said, now those studies have multiplied, that hopefully we'll really see physicians continue to embrace this and embrace it for many different things. So that is certainly our hopes, and I do see it. I do see it being embraced in the future.
Okay, I have another question here. You were talking about the interaction that CBD can have with other medication and how cannabis has this natural tendency to filtering out chemicals. Is there any expected results related to chelation of, like, say, heavy metals coming from the use of CBD?
We're looking at, initially we know that the body, as we were just talking about during the discussion, the body will choose a good metal over a negative metal. And so we have seen, at least in the cultivation of the plants, that the plants can strip these heavy metals. So I think it would be interesting to see if we could obviously find some people that have heavy metal issues or that have been inundated with heavy metals. And that is a possibility, that we could find a couple of cases and then work with them to see if we can actually work to reduce some of those complications of heavy metals, because as we know, heavy metals in the body only reduce your neurological ability, and they completely disable your neurological system. And so that's why, any type of heavy metal can, that is negative, other than zinc, magnesium, and positive good heavy metals that we all know, can really be a detriment to the system. So hopefully I answered that. Okay.
I have two more questions, the two last questions. The first one is, where in the body is a CB3 receptor?
Okay, so we're just locating those CB3 receptors currently right now. So we know that CB1 receptors are typically located in, let's say, the brains, lungs, organs, and then we have CB2 receptors, which are typically located in the cardiovascular system, joints, and you know, you see CB1 really speaking to neurological, and CB2 really speaking to neuropathic. We're finding CB3 receptors are actually located through the differing sectors of the body in both of these sectors. So where we found the CB1 receptors located in just the cardiovascular, and CB2 located in the organs, the brain, I'm sorry, backwards, CB1 located in the brain, organs, hippocampus, etc., and CB2 more the cardiovascular. We're finding that CB3 receptors are actually, and they're still being identified, mind you, but we're finding that they're correlated to both and located in both parts of the system. So that's really interesting. Maybe that's kind of a relay, you know, where we're finding CB1 in this part of the system, CB2, and then there may be a relay. But again, we're in such the infancy of our studies that I think it would be ignorant for me to really go into any further thoughts on CB3.
Wow, it's that new knowledge.
It is, yeah, it is literally like this last 6 months we've been over to the research and identifying these new receptors. So it'll be interesting to cover, and I'd love to cover that in a new talk once we have a little bit more of a arms around that and really do something. Yeah.
Perfect. And the last question here is, Dr. Burch, have you found that people are more trusting of using CBD now more than, let's say, even a few years ago?
I have, Julio. It's been interesting because you've seen people be exposed to that. And at first, you know, a couple years ago, I was a little bit later to the show than my colleague Sue Horton, who introduced me to CBD, who's going to be on with Ian in a couple of weeks. I kind of waited for her to test out some CBD and before I got into the business. And then we started carrying it. And in North Carolina, it was a little bit of a gray area in pharmacy of whether you could carry CBD or whatnot at that point. And they hadn't really made a statement. Then we started carrying it, and then they made a statement that you couldn't carry CBD, or, you know, unless it was grown in North Carolina, which all we have here is dirty tobacco soil. And so we weren't going to buy CBD grown in North Carolina at that time. And so it was a little bit gray area for a little while. So I always, you know, you pushing the cutting edge, selling CBD. So people would come in and they'd creep in kind of, and they'd be like, I want that CBD stuff. I want that marijuana stuff. And you're like, we don't sell marijuana. That's not legal in our state at all. And so they would creep in like it was truly an illegal substance. You don't see.
And then you'd open your coat and you'd have bottles lined up.
Here, I have these right inside my lab coat.
Yeah. In your car trunk, you're just showing all the boxes. Yeah.
And so the stigma has gone away from that. And we have sent flyers out to a number of our providers telling them, hey, we can help your patients. We know they're asking you questions. So we want to be the experts. So send them to the pharmacy. We'll be happy to walk them through how to do CBD. And we've got good quality CBD that we have vetted the quality on, because, you know, that's why people don't see, you know, good outcomes with CBD, because it's poor quality CBD, or it's no CBD in it at all. And right now we get, since we're in the CBD business, we get, I don't know, a new vendor every week wanting us to carry their CBD. And yeah, there's some poor products on the market. When you're carrying some of the top products out there on the market, there's some poor products on the market. And there's one the other day that was just, you think any of the stuff that we've ever tasted was bad. This was horrible. And I'm like, this, you know, why nobody would take that. So if that was somebody's first foray into CBD, they would never take CBD again. And so we walk them through that. We've got some testers open. We let people taste it while they're there, so we can find out if they have an aversion to it, and we can switch a different dosage form or that type of thing. But people are a lot more open-minded to it now than they were a couple years ago.
Okay, awesome. And with that, I think we're just a little bit over past the hour. So with that, we're going to start wrapping up this evening. Thank you so much, Ian and Dr. Burch, for joining us today. Now, Dr. Burch, would you like to tell us more or less what's going on in your projects, and where people can learn more about you, and where people can come learn more from you?
Well, I'm a compounding pharmacist in North Carolina, and compounding pharmacy means we make all the medications we dispense out of the pharmacy. And so I'm not one of the big box stores like a Walgreens that carries traditional manufactured drugs. We work with practitioners and we make custom medications for people. So CBD fits right into what we do, because that's kind of what we do. We work with people to solve problems with their medicines, and for both the human side and the veterinary side. I'm in North Carolina, so I only serve people in the state of North Carolina. There are compounding pharmacies all around. You've probably never seen a compounding pharmacy unless you needed a compounding pharmacy, because you didn't know you needed a compounding pharmacy until then. And so most people will tell you, I've driven by here all the time. I never knew you were here, until they needed a product from us. And so customers are our best word of mouth, because they're the ones that are out there and have had a good experience with that type of thing. I'm currently the president of the Alliance. I'm the chairman of the board. I'm almost done with my tenure here for the Alliance of Pharmacy Compounding, which is the professional organization that represents compounders across the country. Compounding is under pharmacies under the Board of Pharmacies in each state. So we have different regulations in all 50 states. So if you're a pharmacy and you have multiple licenses, you have a nightmare to try to figure out what the laws are in all those states. I only deal with North Carolina, and that's enough. The FDA wants to regulate compounding and keeps trying to reach in and grab a little bit of compounding. And so, I know the CBD industry has the same problems with the FDA, and we say FDA, and we can probably.
That doesn't sound at all like the FDA. I cannot believe the FDA would be interested in that.
We can both agree that that's a 3-letter word that we don't want to have to deal with, and so once again, the FDA, is trying to a little over-regulate compounding pharmacy, and so being active in the professional organization is more for the advocacy side, to make sure that we have the right to continue to compound and help our patients, because that's important. And what I do every day is help patients. And at the end of the day, I've got to be able to continue to do that in order to help them improve their outcomes.
It makes sense, because chemo is so good. All right, and with that, we're gonna bring the evening to an end. Just a reminder for everyone that's been joining us for these live sessions is that on August the 31st at the same time, which is at 3 p.m. Or 6 p.m. Eastern time, we're going to be getting together with Dr. Sue Horton, and we're going to be doing the same format. And thank you so much for joining us. Thank you so much, Ian. Thank you so much, Dr. Burch, for joining us. With this, we'll leave you. Be well, take care, and we'll see you in a couple of weeks. Thank you, everyone. Take care.
Great. Thanks, guys. Good night.
You take care.
Good night.